afternoon. I'm Dr. Joss Reimer, the medical lead of the Vaccine Implementation Task Force. We are so pleased today to be able to celebrate the fact that more Manitobans are immunized than at any other time in our vaccine rollout, and that those numbers continue to go up. We hope this trend will continue, especially now that eligibility is wide open for everyone, including youth who are aged 12 to 17. So I really want to encourage everyone to book your first and second dose appointments online or by phone, visit a pop-up, visit a clinic, your local pharmacy, one of the other vaccine partners that are closer to your home, or even consider one of our walk-in options to receive your first or second dose. The second dose provides the most complete protection against COVID-19 for you and for the people around you. And it gets us more quickly back to the lives that we want to live. If you've already had your first shot, there's only one left to go, and 2 weeks after that, you'll be considered fully vaccinated. Cette semaine, un nombre sans précédent de Manitobains se sont fait vacciner contre le COVID-19. Nous sommes très heureux de souligner l'attente de ce nouveau jalon. Nous espérons que cette tendance se poursuivra, surtout maintenant que tout le monde est admissible au vaccin, même les 12 à 17 ans. Je vous invite tout à prendre rendez-vous pour recevoir votre première ou votre deuxième dose en ligne ou par téléphone, dans une clinique, votre pharmacie ou l'un de nos établissements partenaires qui offrent le vaccin près de chez vous. Vous pouvez aussi vous faire vacciner dans une clinique sans rendez-vous. It's really worthy of celebration to know what we have all done together to protect ourselves, protect our loved ones, and protect our communities. So I want to thank everyone in Manitoba for these exciting numbers. And I know Johanu will spend some more time being able to explain some of those numbers. This week, I would like to spend some time focusing on a few important health topics, different concerns that you might be thinking about, that you've heard in the media, or are talking about with your friends and family. I want to talk today about the effect of COVID-19 vaccines on pregnancy, breastfeeding, fertility, and menstruation, as these are all important topics. And I want to be able to answer some of the questions that people may have, as I've been hearing a lot of these questions. As a practicing physician in Manitoba, I know I've mentioned this before, but in addition to my public health work, I also work in my clinic in the areas of sexual and reproductive health. So I see these questions all the time from people who are pregnant, from those who want to be pregnant. These are common concerns that people bring in. And so I want to be able to reassure you about the vaccine in all of these settings. If you are pregnant, you are at an increased risk for severe outcomes from COVID-19. So vaccination should be top of mind and a healthcare priority throughout your pregnancy. There's a recent national study that looked at COVID-affected pregnancies. It included Canadians in all 10 provinces and 3 territories, and looked at all 3 waves of the COVID pandemic. There were more than 6,000 pregnancies that were affected by COVID-19 and were included in this research. The study found that people who were pregnant in Canada had a 4 times risk of needing ICU treatment if they got infected with COVID-19 compared to people who were not pregnant and of the same age. During the third wave, that number went up. At this point, the early reports are suggesting that the risk of needing ICU admission for someone who is pregnant and is infected with COVID-19 may be as high as 11 times the risk for someone who is not pregnant and the same age. So perhaps more than any other time in someone's life, the health and protection of yourself and of the developing child is always on your mind. So today I want to be very clear. Scientific evidence demonstrates that mRNA COVID-19 vaccines are safe for people who are pregnant or breastfeeding. there is no evidence that exists to suggest that any vaccines, including those that protect you from COVID-19, pose a clear health risk to people who are pregnant, nor to the unborn children. The National Advisory Committee on Immunization recommends that if you are pregnant, you should get a complete series of an mRNA vaccine. The Society of Obstetricians and Gynecologists of Canada also recommends that this vaccine be offered to anyone who is pregnant. Les faits scientifiques montrent que les vaccins à ARN messager contre le COVID-19 sont sans danger pour les femmes enceintes ou qui allaitent. A study of 4,000 pregnant people in the US showed that not only is the two-dose vaccine safe, they also showed that during the study period that 97.6% of participants remained COVID-19 free. Some people have asked whether the COVID vaccines can help the developing fetus as well. The answer to that is yes. The anti-COVID antibodies that a person develops when their immune system responds to the vaccine can cross the placenta. That means that they do go to the developing baby and can protect that baby after they're born. And during pregnancy, because we know that COVID-19 causes more severe illness than when you're not pregnant, this, together with the safety data we have from Canada, from the US, and around the world, means that we recommend that you go for the vaccine if you're pregnant. And I also recommend that you talk to your healthcare provider. If you have questions about the safety, if you have questions about your personal health circumstances, your healthcare provider is happy to talk to you about those. I would also like to address some of the reports which are circulating online about possible changes to menstrual cycles that can occur shortly after and as a reaction to receiving a COVID-19 vaccine. So it has been suggested that shortly after receiving the vaccine, some people might experience spotting or bleeding arriving earlier than their expected period or a few days after receiving the vaccine. There's also been individual reports that claim that they're having heavier periods or lighter periods or more uncomfortable periods following vaccinations. In reality, the impact of vaccines on menstruation is not a heavily studied area of medicine. If a person experienced heavy bleeding after receiving a vaccine, that would likely be tracked in our surveillance systems. But minor changes, such as an early period or spotting or slightly heavier or lighter period, would likely not be picked up in our surveillance systems, as people don't tend to report those. As most of us are aware, periods can change from light to heavy. They can sometimes be early or late due to many different factors. Some of those factors can include sleep cycles, stress, your diet and exercise, age, other health conditions, and the list goes on. From my clinical practice in sexual and reproductive health, I can affirm that irregular periods are incredibly common. This is something that people come to my clinic for often. So while we are hearing these reports from individuals, the most likely explanation is that people are having changes to their period that they would have had anyway. It's very common to have these changes. It is possible that the irregular period could also be due to the pandemic and the stress that people are experiencing and the changes to their lifestyle during COVID. All of that said, it's theoretically possible the vaccine could temporarily cause some irregular bleeding. The endometrium, the inside lining of the uterus, does have immune cells in it. So while there's no evidence that this occurs, it's theoretically possible that the endometrium could temporarily experience a reaction along with the rest of the immune system. And theoretically, that could cause some irregular bleeding. So while I think this is unlikely, and we don't believe that this is happening with the vaccine, even if it were, it would be temporary, and it would go away along with every other aspect of that initial immune response. It is very normal to be concerned about changes to your body at any time. But when you're being vaccinated, and certainly throughout pregnancy, these are times where people are paying additional attention. So a few more facts, this time about breastfeeding. You may wonder if antibodies are in breast milk. And the amazing answer to that is that yes, they can be. COVID-fighting antibodies that are developed in the immune response are found in breast milk. And in some of the lab studies, the antibodies of people who were vaccinated against COVID-19 were able to effectively stop the COVID virus from functioning. This means that there is a potential that consuming the breast milk can help protect a child from serious illness related to COVID. Antibodies are detectable in breast milk 2 weeks after vaccination and continue to increase up until 4 weeks. Most samples in the study were found to have antibodies by 6 weeks after the vaccine. So this is all reassuring data, and it all points to effective newborn protection. Parents and grandparents, siblings and friends, we all want to protect the health of parents and their babies. And during a pandemic, the best way to do that is to get vaccinated and then to get vaccinated again. If you are someone who is trying to get pregnant or the partner of someone who wants to be pregnant, you may also be wondering if it's safe to be vaccinated against COVID-19. And again, the answer here is yes. You should be vaccinated. None of the COVID vaccines cause infertility. None of them will affect future pregnancy. Si votre partenaire ou et vous-même sentez de concevoir, vous vous demandez peut-être s'il est sécuritaire de vous faire vacciner contre le COVID-19. Oui, c'est tout à fait sécuritaire. Vous devriez vous faire vacciner. Aucun des vaccins contre le COVID-19 ne rend infertile ou n'aura d'incidence sur la future grossesse. La vaccination ne altérera en aucun cas la capacité d'une personne de tomber enceinte. A person's ability to become pregnant will in no way be affected by getting vaccinated. And we have studies that have looked at this. One study looked at egg production before and after the vaccine and found there was no impact. Another study looked at people who were already experiencing infertility before the vaccine and found that they were just as likely as anyone else to achieve pregnancy after the vaccine. So if you are trying to get pregnant, if your partner is trying to get pregnant, getting the 2 doses is important to protect yourself and protect your family. So shifting away from pregnancy, fertility, and breastfeeding, I also just wanted to briefly talk about what we call breakthrough COVID infections. This term refers to the rare cases when a person has been vaccinated against COVID-19, but still contracts the virus. We know that none of these vaccines are 100% effective. But we also know that it's very rare to get infected after the vaccine, and even more rare to become severely ill. So in all of our COVID-related hospitalizations in Manitoba from January 1st to June 27th, only 1.2% of the people in hospital were fully vaccinated. Now these percentages will likely go up because more of us are being vaccinated. And as more of us are vaccinated, we are more protected, but there's still a larger pool of people that could potentially end up in the hospital. And so those percentages can change. But that doesn't mean that the vaccine isn't working. That's really a testament to how many Manitobans have gone for their first and second doses. So I don't want anyone to be concerned about these breakthrough cases. They are very rare, and I don't want them to prevent anyone from being vaccinated. We did receive some notification from Health Canada regarding vaccine security. So we've entered a phase now where more and more Manitobans are rushing to be vaccinated, and that's exactly what we want you all to be doing. And we've also heard that while this is not happening in Manitoba, it is possible that individuals or private entities may use this time as an opportunity to commit fraud. Health Canada has been made aware of some people claiming to have access to vaccines for sale. They're also aware of circumstances where people have been notified about next steps after the vaccine from people that were not authorized to provide information. So please be aware that the COVID vaccine is not for sale. If anyone tries to sell the vaccine, this is illegitimate and should be immediately reported. And again, we have not seen this in Manitoba at this time. But if you are aware of any suspicious vaccine activity, such as someone trying to sell the vaccine or supply it in volume at a cost, please do contact your local law enforcement agency. So moving on to interchangeability, the largest and best study to date from the University of Oxford in the UK has reported some results. They looked at the effectiveness of vaccine interchangeability and found, again, like the other studies, that mixing vaccines has the same or better immune response than taking the same brand of a COVID vaccine twice. So this is a study that we had been talking about in May and had been expecting results in May, and those results were delayed until now. But I wanted to bring it up because it does reinforce what we've seen in the other smaller studies. What makes this study particularly convincing is that it's a randomized trial, and the fact that the participants didn't know what vaccines they were receiving. So both of these factors mean that the study had a lot less bias than some of the others may have. The findings of the study reinforce what the medical and scientific community had been predicting, that vaccine interchangeability is a good thing, or at least neutral, but in some cases may even be desirable over taking the same brand twice. The research strongly supports the decision to recommend and to continue recommending mRNA for dose 2, no matter what you receive for dose 1. In the results of the study, the immune response proved to be the same whether you took 2 doses of Pfizer or if you took a dose of AstraZeneca followed by a dose of Pfizer. The study also found that the immune response was stronger if you took the mixture of vaccines compared to 2 doses of AstraZeneca. So this is really reassuring because we've seen good effectiveness data about AstraZeneca throughout the world, but particularly coming from the UK. And so to see that the immune response was stronger with the mixing of vaccines just provides that much more confidence to us that providing the mRNA after a dose of AstraZeneca will be an effective way to protect ourselves. So before we move on to Johanu, just wanted to talk about the heat wave that hit the western parts of the country earlier this week, because it's now appearing in Manitoba. We're seeing temperatures in the low to mid 30s in many parts of Manitoba, and maybe higher into the higher 30s later on this weekend. Heat can have serious effects on people's physical health, mental well-being, and cognitive ability. Older adults, people with chronic illness, people living alone, infants and young children, and people who work or exercise in the heat have a particularly high risk for heat illness. Heat illnesses are preventable, so we ask you to be sure to take care of yourself and others as we go into the holiday tomorrow and the weekend. If you're planning on attending a vaccine clinic and you expect that you might have to wait outside, please bring some water, put on sunscreen, and wear a hat. If you don't have air conditioning at home, consider going to a cool place such as a mall, a community center, public library, or a place of worship, but do ensure that these sites will be open before you go, because we know that the hours in different sites will be different tomorrow and again different on the weekend. All of these things will help reduce the risk of heat-related illness. We also encourage people to attend things like splash pads if you have that available to you. And finally, today, reflecting on seeing the shoes on the steps as we arrived at the ledge today, I just wanted to take a minute to acknowledge the amazing work that Dr. Anderson, Melanie McKinnon, and the whole pandemic response team has done throughout this pandemic, but in particular throughout this vaccine campaign. This last month has been incredibly traumatic, and I'm so thankful to have you as colleagues, so thankful to the community organizations who've been providing services to the Indigenous people throughout Manitoba. And so just wanted to take a moment today as we reflect on what we're hearing in the media and on the shoes that we saw outside of the legislature building today, just take a moment to thank that whole team, certainly on behalf of myself, but I think I can speak on behalf of the task force as well, to thank you for all of the amazing work that you've done, especially during this traumatic last month, for Indigenous people in Manitoba, both in the urban centres as well as in the communities all around the province. And with that, I will turn things over to Johanu.
Thank you very much, Dr. Reimer, and certainly from the operations side, we echo all of those comments. Good afternoon, everyone. I'm Johanu Botha, the Operations Planning and Logistics Lead for the Vaccine Implementation Task Force. This past week and over the weeks to come, record numbers of Manitobans are turning out for their first and their second doses. In fact, so many Manitobans have rolled up their sleeves that Manitobans are now amongst some of the most fully vaccinated people across the country. We are hitting even more milestones across the province, and the team and I are very excited to see them and to share them with you. On Monday, we had our biggest day ever, approximately 35,000 doses administered across the province on that day. And by the end of today, more than 1.4 million doses of vaccine will have been given. It will have taken us only 4 days to give that last 100,000 doses, which goes to show how fast our team and our partners and our system can work if we have enough supply, but also goes to show what we can do when Manitobans roll up their sleeves so we can get back to do the things that we love to do. We're getting close to having 3/4 of eligible Manitobans with at least one dose, and as of today, 42.4% of Manitobans have at least had 2 doses. None of this, of course, would be possible without the staff and the volunteers and our partners who make all this happen. I want to express our huge thanks to everyone on the front lines at every vaccination site and behind the scenes for going above and beyond every day to make the vaccine available to everyone in our province. With more vaccine coming in the weeks ahead, we know there will be a big push to immunize people. And our staff and our partners and volunteers are all integral to this work. So while many people are starting to look forward to a weekend away, a weekend camping, just some time off, lunch with friends on a patio, we are turning to our partners and our team and our staff again for one last push. I know we're asking a lot of our teams to fill all those shifts to get sites to get needles into arms. You are lifesavers and you are community heroes, and there is nothing that we can say to truly reflect all the work that you're doing. Regarding vaccine allocations, the information that we receive from the federal government still does evolve from day to day. We are working with our federal counterparts to ensure that we have enough vaccine to meet all booked appointments and forecasts for walk-in clinics, our pop-ups, especially our community-led sites, pharmacies, and everywhere else the vaccine is being administered. Today is also a big day for hundreds of young people and their parents or caregivers or guardians, since it is the first day of walk-ins for youth aged 12 to 17 at the Lila Super Site. This Pfizer clinic is only for youth who need either their first or second dose, and we are expecting, and indeed we've seen extremely strong interest. So the clinic is going to run on a ticket-based system today and every day until it wraps up on the 6th. People who arrive at the site will receive a ticket and be asked to return for an assigned time slot to get their vaccine if there is one available. We hope that'll help improve the experience at the site for as many people as possible, so that folks aren't waiting in the heat, and so that they know right away whether there is a dose available for them, and if so, when they will be able to get that dose. Overall, we need to keep this momentum going for both youth and adult vaccinations. There is good reason to believe that we will, as we continuously expand the options for Manitobans who get vaccinated quickly, conveniently, and as accessibly as possible in neighborhoods, super sites, our pop-up clinics and pharmacies, and all our physician partners, of course, and all the new community-hosted clinics. I would like to highlight a few stories we've heard this week that demonstrate the tenacity and the organization and cooperations of Manitobans in this effort. As I've spoken before, we are providing a vaccine to dozens of community organizations, businesses, and other partners to get people immunized. In total, from late June onwards, these efforts will make at least 20,000 vaccines available to people who might otherwise face barriers to being immunized. And as a part of this outreach and with the support of a focused immunization team, as a nice example, clinics were provided with more than 1,000 doses administered to High Life employees in Nipoa. This included an on-site immunization clinic, as well as a dedicated clinic for these employees in the community, available during work hours with the support of the company. And similarly, we had 2 clinic days were booked for employees of Maple Leaf Foods at the Keystone Center Super Site in Brandon. On-site interpretation was available, and in total about 830 doses were administered. And while we're talking about southwestern Manitoba, we got a nice note from Brandon Mayor Rick Crest with a story about how amazing the staff at the super site at the Keystone Center adapted in an unforeseen event. Mayor Crest was heading in to receive his second dose, and partway through his visit, the site experienced a fire alarm right in the midst of this already complex site operation. Mayor Crest wrote to us and noted that without much delay, the staff pivoted their activities and proceeded to usher everyone outside, probably 100 or more people. Happily, it turned out to be a false alarm, and after 10 or 15 minutes, they began to methodically cycle everyone back in the building and just picked up everything where they left off. I think this is representative of our super sites across the province and how professionally this was handled, so thank you and kudos to the Keystone Center. To shift topics a little before we go to questions, I do want to provide a quick update on the process for updating the vaccination or your vaccination records. As you'll recall, this affects people who have either received one or more vaccines out of province or who have found that the information in their immunization record is recorded incorrectly, is missing, or has some type of other error. Your immunization record is, of course, the information source for your immunization cards. So as more people are becoming fully immunized, there is understandably a big pressure on our system to ensure that people's records are up to date and they can apply for their vaccination cards. So the demand on the system is quite high. There were thousands of correction requests, and those corrections are being resolved quickly. Many thousands of them already have been resolved. But moving forward, anyone with a similar issue can now submit it using an e-form as opposed to the email-based approach, which is available at manitoba.ca/vaccine. So this collects consistent information, and it's a bit more streamlined, and this will help us to address the situation as quickly as possible. We want to be able to either resolve or address an issue between 3 days to a week, depending on when their data was entered into the system. And there's also work underway on solutions for people who cannot access this web form online. So they have questions or concerns or need to access either their immunization record or request the Vax card itself. So we're working on that type of a phone option that'll be ready in the coming days. We're actively working on that piece. So with all that said and that update provided, let's go to questions.
Thank you. A reminder to our reporters on the line, you will have 1 preliminary and 2 follow-up questions. Up first this afternoon from CTV Winnipeg, Stephanie.
Hi, good afternoon. We're hearing that some people who were in line for the walk-in doses of Pfizer at the Leela site were given time slots for other days. We are under the impression that if you get the ticket or get the time slot, it's for that same day. Are you able to confirm this? And if that is the case, how will this impact that walk-in supply over the next few days?
Yeah, Yeah, so we're aware that did occur, and there's such a tremendous interest that staff wanted to ensure that those who showed up had some chance to go. Our goal, though, is going forward is to provide the tickets to those who can receive on the same day. So it still remains a walk-in option for the subsequent days. So it may have happened, and then those individuals will be able to get their vaccination. But the goal going forward is to have this be a walk-in model and not sort of a de facto appointment model by getting a ticket earlier on. So it's for individuals who can show up on that day. And this is another sort of a good example for why it's not that useful, or it shouldn't be that useful for individuals to arrive the day after or the night before. That's not ideal. It's a walk-in option. So go that day, and then you'll get a ticket. And if you can already go in line, you'll be able to. And then if you have to wait a while, you can come back later on. So we'll streamline that, but the goal is for it to be a walk-in option where you get the ticket for that day.
Thank you for that. And we're hearing about a Steinbach pastor who says he's kind of been bombarded with angry messages after appearing in the government's ad campaigns to encourage vaccinations and uptake in areas where it remains low. Do you have any messages for that pastor who's, put himself out there to help in the vaccination effort? And what other strategies is the task force looking at to boost vaccination rates in low areas?
I'll briefly comment from a delivery operations perspective and then go to Dr. Reimer. We've had so many community leaders, local politicians, local community activists, and then certainly religious leaders support us in our effort to increase uptake across the province. And so to all of them, especially some of those who are facing challenging times, I think there's a tremendous thank you for the team during this effort. So we do thank them so much. And I think I'll keep it as high level as that, and then go to you, Dr. Reimer.
Yeah, I think my message for Pastor Kyle is thank you. Many of you may remember the original tweet thread that he had about how best to reach communities and effective mechanisms to connect with people. And that helped inform some of the work that we've done. So I really commend him for the work he continues to do, and for the response that he's had even to people sending him those unpleasant and sometimes threatening messages. We're so thankful to him and to everybody else who may be experiencing the same things. I know some of the doctors that participated in some of the town halls received unpleasant messages from people as well. What I will flag is that in a lot of these cases, it doesn't appear to be local people who are sending the messages, and seems to be more coming from outside of Manitoba. But there's not much we can say more than thank you, and that we hope that people continue to advocate for the health and well-being of their communities, and that we want to be able to support that work in any way that the community leaders would find helpful. So really encouraging them to connect with us as well if they're experiencing any of these responses, and even if they're not, if they want to participate in ways to connect with their community. And Pastor Kyle's just one great example of how that leadership can really shine and really help inform a community by seeing somebody who's trusted.
Thank you for that. And finally, are you guys able to provide just maybe some of the logistics of the process, just in terms of the 10% of available doses for walk-in appointments at the super sites across the province minus the convention center?
I just missed the last part of the question there. Which process about the walk-ins is the question about?
Yeah, I saw in one of the vaccine updates just how there's about 10% of doses available per day for walk-in appointments at super sites. So just if you could maybe talk about the process for someone who maybe is interested in doing that.
Oh, gotcha. Yeah, no, thank you. Thank you for that. So it is approximately 10% of doses of any day's capacity at our super sites has that walk-in option, except for RBC. And so the best way that individuals can identify whether a site does have a walk-in option, that information is available online, and then they can arrive at the site based on its opening hours to see if there is an opportunity to get a walk-in dose. Upon arrival, depending on how busy it is, they may get the ticket option that we were talking about to come back later, so they don't have to wait in line, especially given the upcoming heat. And at other times, especially the smaller sites, they should be able to walk right in. First doses are being prioritized when they showed up, but by all means, second dose individuals can use this option. Most sites, whenever they're operating, has some of this capacity left over. If they don't, it'll be either clear online, or some of the smaller sites will have in their local media, or even big signs outside their sites will say accepting walk-ins or closed for the day for walk-ins.
From City News, Mark.
Good afternoon. Thanks for making yourselves available. Going to the pregnancy conversation, I think maybe some moms may have heard if they get both vaccines while their baby is still unborn, would they potentially be giving birth to like a fully vaccinated child? Or if not, that plus breast milk, would that maybe make them almost fully vaccinated? Can you talk about what level of protection parents could expect for their kids if they do that?
Yeah, so one of the really wonderful things about how these vaccines work during pregnancy is that the antibodies do cross the placenta. And so the baby after birth will have some of those antibodies temporarily. Because their own immune response, so the baby's immune response, has not been triggered. It's more like if we gave somebody a dose of just straight antibodies, which we do sometimes. It's called IVIG, but it's more like a temporary protection. But because the immune system isn't triggered, they don't have an ongoing ability to fight the virus. So it's wonderful that we use this, say, for pertussis or whooping cough, that for the first few months of life, those antibodies they circulate and they slowly disappear. And that helps protect the baby until they can get their own vaccine. Now, with this vaccine, it's not approved until age 12 at this point. So these antibodies will not protect the baby until age 12. They're really more going to protect for a few months. But the first few months of life are a very high risk time of our lives. Infants in the first few months of their life experience some of the highest risks of severe illness and of death than any other time until we get to the very elderly. So even if we're only protecting a baby for the first few months of their life, we're getting them through to a point where their immune system will be stronger, so that if they were infected later on, they would have a better chance of doing well compared to if they were infected at 1 month of age. And in the future, we may see approvals down to 6 months of age, because both Pfizer and Moderna are doing studies down to 6 months of age. And so the connection between the temporary antibodies and the vaccine might be closer in the future if those vaccines are approved.
Thank you. I saw in the update today that if an adult has a Pfizer shot and they want to share that appointment or give that appointment to a child, they can. If a person had a Pfizer shot but didn't have a child or a niece or anyone in their family circle, is there like a shared collective spot they could go to throw up a hand and say, I have one and it's available? Or does that exist?
So we don't currently have a pool option available. I think that's sort of what you're getting at, where you can just give up your shot and say that put it in a pool and ensure that a youth gets it. So we can look at that. What we do have available, though, is the transfer option, whereby any adult can pass their Pfizer shot to any youth. So it doesn't have to be a family member or a child, or you don't have to be a guardian of said youth. So you can, if there is that kind of desire to provide that kind of option to youth, especially since Moderna is available And by all accounts from the medical team, we're still reminded very effective and also mRNA for an adult. If an adult can get a Moderna mRNA instead, and they want to open that up for another youth, the Pfizer option, then that's great, and they can do that via the same process that a parent would do that for the child online.
You both sort of opened up talking about the positive place that we're in right now. The pandemic pendulum seems to have moved from where we were leading infection rates to now being amongst those leading with vaccination rates. Do you think there's one thing behind that? What do you think specifically has allowed us to move in this direction?
I mean, I think we've got a great team. We have the folks who are working in the variety of different clinics. We have our physicians and our pharmacists, our pop-ups, all of the community organizations, and then every single person in Manitoba who's been so eager to get the vaccine and to get out of that third wave. And I think there's also just that collective feeling that we don't want these public health restrictions anymore. So, I can't say enough about the team, from the planners to the people checking the numbers, to those administering the vaccine, those greeting people when they come in or doing the data entry. Everyone all the way has been really fantastic and stepping up and working so hard. But none of that would matter if Manitobans didn't come. And so, I think we're so thankful to see that we're leading the country in fully vaccinated people, because that's what we want. We want to get all of us protected so that we don't have to hear about people in the hospital and read about people's loved ones dying anymore. And then second to that we want to be able to see each other again and be able to gather and go back to some sort of pre-pandemic way to socialize and hopefully get our mental health better and get our economy better. So, there's an awful lot of drivers, but mostly I think that Johanu and I are just thankful to everyone.
From the Winnipeg Free Press, Danielle.
Hi, and good afternoon. Can you say how many Manitobans have opted for a mixed mRNA schedule, and has that helped speed up our administration rates at all?
So I don't have that specific figure in front of me on how many have opted for the interchange. So we will have to run that number and the analysis and get to you, Danelle. I believe you asked that last time, so we should run it and get it for you. But what I can say is that I do think that it has sped up our velocity, to be sure, for those adults who were willing and able to go either to a walk-in Moderna appointment or go to an earlier Moderna appointment. Overall, our timelines are looking really rosy because of the amount that's going to come in by the end of July. But it's really good to get those numbers up now for all the reasons that Dr. Reimer just mentioned. So absolutely, it made a difference to have individuals go for the second dose that they can get.
Okay, thank you. I will follow up. And Dr. Reimer, we're wondering if, based on the data that the province collects for vaccine uptake by both region and ethnicity, whether you're seeing a high uptake rate in communal living colonies.
We don't have any of those numbers available right now. We started collecting some of the ethnicity data, but fairly late in the rollout, so even that's going to be quite limited in our ability to do a fulsome analysis. But we do have it by geography and can go to fairly small geographies. And so because of that, we probably could do some analysis looking at some of the, I'm assuming you're talking about some colonies and other types of communal livings in rural areas. So that is something that we could take back to our epidemiology and surveillance team to see if they can pull together an analysis, but certainly we haven't done one to date on that topic.
Is there, I guess, in the absence of that analysis, are you concerned that uptake rates might not be as high as they ought to be, or because those settings are more vulnerable for COVID spread, are those areas an area of concern for you?
So any sort of close quarters communal living or even workplace where people are interacting in large groups in small spaces is a concern for us. And so we've asked each regional health authority to look at their food production and manufacturing workplaces, to look at things like colonies, to look at other communal living that maybe we didn't think of, or their work camps, temporary foreign workers. And do that assessment because they know their communities the best. And so in each regional health authority, the approach and the analysis has been a little bit different because they're adapting it to the needs of the local communities. So I know that all of them have been going to different settings that are most appropriate for their region. And we're really happy that we can use their knowledge and expertise to tailor the response to what the local needs are. But that's why we don't have the same sort of provincial level plan as we do for many other things, because it is so important that that local knowledge be used to help prioritize where to go with these vaccines.
From Global News, Anya.
Good afternoon. Recently, there have been some direct efforts to encourage specific communities and groups to get vaccinated. Have there been any signs that this approach has worked?
So the one sign that we can look at a high level, and then I can pivot to Dr. Reimer on specific communities, is really that dose one coverage stat, which is the amount of Manitobans with at least one dose. We're seeing Manitobans with 2 doses, which 2 weeks after their 2 dose, they're fully vaccinated. I mean, that's really skyrocketing. It's very clear that individuals who've had their first dose want their second dose, especially here. And with the models that we have, that's sort of why we're sort of flirting between 1 and 2 in the country in terms of being fully vaccinated. But what we're also sort of watching like a hawk is that dose 1 coverage, which right now is about, it's just over 73. Today we're going towards the 3-quarter mark. And what we have seen over the last couple weeks or so is it was leveling off and it's slightly going back up in speed, where it used to increase by 0.2% or so every day. It's now 0.3, 0.4. So that's a really broad indicator of a uptick, a slight uptick in the dose 1 interest. And I think it probably reflects a whole host of factors, whether it's the incentives at play, the beginning of community-hosted clinics, the walk-in option, more and more communication engagement with communities. We're seeing a positive early sign that we are increasing up on that dose 1, certainly to the point where we're going to meet all those targets. But maybe at a more regional approach or in a specific community, I don't know, Dr. Reimer, if you're seeing anything more specific in terms of dose 1 increase.
Yeah, I think we're still early in what we've talked about as the really challenging work of reaching out to people who experience challenges with accessibility, or those who are still having a lot of questions about the vaccine. And we don't expect that we'll see a sudden increase in any of those settings. We expect it will be a slow and steady ongoing uptake. And that's what we're seeing. We're seeing that in all of these settings, we're having a slow and steady increase in doses. And we just really want to get higher in our first dose coverage. So, for those people who are waiting and wanted to see how the vaccine impacted other people, this is the time. You can look to your friends and your family, because there's been 1.3 million doses that have gone out in Manitoba and over 2 billion doses around the world. So, I think it's great if you now look to the experiences that other people have had and see, how this has been protecting our personal care homes, the huge drop we've seen in the number of people dying related to COVID, and get some confidence from the experiences that other people have had and sign up now. So, each community is going to have to do different approaches, but we're certainly happy to see the slow and steady increase.
Thank you for that. And kind of on the same track, what is your projected date for us to hit that second vaccine milestone? And are you, in your opinion, are we moving faster through this vaccine process than you would have thought?
So our Our internal projections at this point depends largely on two factors that can be out of our control, like supply and continued uptake or demand from Manitobans. We know the capacity is there. And in terms of supply, things are looking good. It looks stable, but it does change by the day with the federal government, so it's something we do have to continue to monitor. And in terms of the demand from the public, it's also looking good, but that's also something out of our control to a large extent. Of course, it's under our control by providing as accessible options to Manitobans, but outside of that, Manitobans have to make the decision. So because those two key factors in our projections are out of our control, I think we're careful to lock in a very specific date. What we can say is that we have the capacity in place for us all to beat those targets, assuming the supply is there. And so if Manitobans keep rolling up their sleeves, yes, we do anticipate to beat those targets. By how much and by how fast, as long as the supply comes in and our capacity holds, which I think it will, it's really up to all of us together. So sorry for a bit of an ambiguous answer. We intend to meet those targets, but hesitant to lock us into a specific day. We're sort of all in this together, watching how fast we all get there.
Okay, and my last question, more so for Dr. Reimer, about the irregular cycles some women might be having. If a woman is having an irregular period and they did just get the vaccine, should they be reporting this to their doctor? And if they do, will that information be tracked so that we can have better information about these types of things in the future?
Yeah, like I said, it's incredibly common to have changes to periods. People experience lighter, shorter, longer, different timing, sometimes spotting in between periods all the time. And so, we don't believe that the vaccine impacts periods just because of how much there already is as far as variability in that anyway. But if people experience significant impacts, so if they did have some heavy bleeding that was impacting their health, or were concerned that they missed several cycles, something like that, we would want to hear about those. If people are having a small amount of spotting, or they think their period was a day shorter or a day longer, a little bit lighter, a little bit heavier, I don't think that they need to report those to their physician, because even if that was occurring, that wouldn't be something that would cause us to caution people about the vaccine, because it would be temporary and not expected to have any significant long-term health outcomes. So certainly if people experience a serious or significant change or something that is impacting their health or their ability to function, we would want to know about those.
From the Brandon Sun, Kimberly.
Good afternoon. This is for Mr. Botha. Last week, we were approached by someone having a problem accessing the phone for their vaccination card. And the spokesperson at the time said that you were aware of the problem and were working on it. So this week, more people are applying for their vaccination cards without internet access and can't access the phone line. And we're also being told by Prairie Mountain Health, Manitoba Health, and a spokesperson from the vaccine that immunization cards can only be requested online. And today, you're telling us that you're aware of the problem and you're working on it. And on the 8th of June, there was a release with that phone number in it. And so the messaging is confusing for a lot of people. Do you know how much longer we have to wait before people can access this phone line before the issue is resolved?
Yeah, thanks for that, Kim, and I agree. It has been confusing, and it is frustrating for individuals who don't have online access to get this resolved quickly. So, in terms of the accessibility approach or getting a phone number in place that can handle this level of demand, we're actively building that. And I'd love to be able to sit here and give that number and say it's good to go right now, but we want to ensure that it has all the capacity in place, all the boxes have been checked, so when we release that number, that it can do the job. Because, frankly, the first number that was out there, we didn't quite anticipate the demand on the system. Now, in terms of the scope of the issue, I should stress that, if we do 20,000 doses a day, and we're doing much more than that, but let's say we do 20,000 doses a day, and there's just a 1% error rate in the data entry, that's still 200 individuals who are impacted on that day. Now, in any operation of this size, the scope of our vaccine enterprise and the amount of individuals involved, a 1% error rate is pretty good. So what we need to do is try and reduce that error rate, to be sure, but really build a process that has the capacity to deal with approximately 200 people, ideally less, who have an issue or a concern or a question about their records and why it isn't there. So it is unprecedented with the amount of data that's being entered every single day in this province. It's expected, given that we're ultimately human beings implementing this, that there will be an error. So what we need to do now is ensure that we have that process in place. The web form should work very well for those who have access now. That should also allow us to do our jobs better, because the email address saw many duplicates that we then have to tease out. So the web form allows us to address some of that. But the phone line is big, and we understand that. So to your question, when will this be ready? Within the next couple of days. We just want to make sure that the phone line and all the agents has all the capacity and the right access to the system to address this. Our overall goal is to ensure that individuals have their vaccination record correction, question, clarification addressed, within 3 days to 7 days of having submitted it. And the reason we give that time frame is that there are pop-ups and focus immunization teams, and certainly some of our community-hosted clinics, who the data will only appear, 3 to 7 days after it's been administered. It's our super sites are pretty much day of. But there is a bit of a gap there for some cases, depending on where you received the vaccine. But we will strive to have that all addressed within 7 days for those who have an issue. And we're almost there. I think upon our last check, everything before June 23rd has either been resolved or addressed. So that means that we're working on things that came in the last week or so. But given the scope of how many doses are being administered each day, these are going to keep coming in. People are either going to have queries, or there's going to have to be a correction that needs to be made. So long story short, we do apologize for the continued wait for this. We are addressing it. We'll have a phone option available that works, along with the web form that we now have in place.
Okay, well, thank you for that. So in the meantime, what are people without internet access supposed to be doing?
So the records, changing your records is not, it's absolutely important, and we understand sort of the need to have it accurate there, and then so that individuals can apply for their Vax cards. But there's no harm being done to their existing record by waiting for us to get that phone line up. So I would wait for those couple days, perhaps even today, so that we can have the phone line up to make the call. For those individuals who are even sending in information on the online form, it's not like it's being addressed within that very second. We have to go and tease out where the actual record is. Is there a mistake in the first place? If it's out of province, or out of country, is it something that Canada recognizes? Every single individual case requires some level of investigation. So it does take some time. If someone, once this phone number launches in the next couple of days and it's addressed within a week, that is not a bad range of time for the data to be corrected and for the individuals to get their Vax cards. So there is an option where individuals can ask someone else to help fill in the form online. In the meantime, we're working on getting that phone number back up.
Okay, thank you. I have no further questions.
From CJOB, Clay.
Hi, good afternoon. I'm not sure if this has already been asked, but we have had some people, listeners, calling saying that they filled out all the paperwork and sent it off, and they've been waiting for their vaccination card to come back in the mail, and they've been waiting for about a week and a half now. Is that unusual?
So the time frame on getting the Vax card, I'll have to see sort of what the average is. I think we have over 190,000 of those out without issue. Exactly what the exact time frame is, we'll have to confirm. We don't have, unlike the vaccination record correction process, we haven't had a significant issues arise in terms of requesting the Vax card and receiving it.
All right. And my second and final question, I don't need to ask a third at this time here. Have there been any new cases of Manitobans who've been infected with COVID-19 after they've been fully vaccinated?
You know, I don't have the numbers in front of me right now, but we do see, you know, small numbers of cases amongst people who are fully vaccinated, and we expect we will continue to see that. In the ideal best case scenario of the original trial, the protection was 95%, which is amazing for a vaccine, but still means that 5% of the time it didn't work to prevent infection. So I don't know the exact numbers in, say, the last week, for example, but yes, we are seeing ongoing cases in people who are fully vaccinated, and anticipate that that will continue to be the situation until the virus is no longer circulating here.
Then I do have a follow-up. Are these people that were infected perhaps did not follow the protocols, you know, wait the full 2 weeks before they, for whatever reason, began to socialize or what have you?
So when we talk about people being infected, or so a breakthrough case, we're really referring to people who we tested positive more than 2 weeks after their second dose, or at least more than 1 week. We actually measure both of those numbers. So we're not talking about people who tested positive within the few days after their dose. Those would be counted along with the first dose, because we know that it takes more than a few days for the immune system to respond to the first or the second dose. And as far as the actions that people have taken, the virus is present in many different situations, and in some cases, despite people's best efforts and following all of the guidelines, the virus can be present where we don't expect it. So, you know, I can't speak to any of the individual choices that any of those people made, nor how much control they had over their situation. I can only say that we're referring to people who tested positive at minimum 7 days or 14 days, depending on which one we're measuring at that time, after their second dose.
From the Winnipeg Sun, Scott.
Hi, I'll refrain from asking Johanu about how he keeps his suit clean. I'm wondering if you can tell me, in terms of the mixing doses for pregnant women, I don't know if, I can't remember if you actually touched on that. Is that safe?
So the immune response during pregnancy is no different than outside of pregnancy, and we don't anticipate any differences for people who are pregnant in their response to these vaccines. So our recommendations are the same for pregnancy as they are outside of pregnancy regarding what vaccine to receive for dose 1 and for dose 2.
Okay, thanks for that. People see the AstraZeneca plus the Pfizer dose, and you know that's all good and well. People don't necessarily see that with Moderna. So I'm kind of wondering, you know, they're both mRNA. So can we conclude that, you know, it's relatively the same for that as well?
Pfizer and Moderna work in the same way. So the messenger RNA is that instruction sheet that tells your body how to produce the spike protein that triggers the immune response. And so the response from the immune system is the same because it's it's being triggered in the same way. And so we do see these as equally effective, functioning in the same way, and our expectations are that there's no difference in those. where possible, getting the same product for dose 1 and dose 2 is ideal, just because that's what the original studies looked at. But there's no reason for us to expect that they would be different, and that's why we do encourage people to get whatever dose they can get the fastest, so that we can all be protected as quickly as possible. I know that there has potentially been some brand preference toward Pfizer, and I think that there's probably two large reasons for that. One is that people are just more familiar with Pfizer than Moderna. Pfizer is a bigger company that makes a larger variety of products, so people have heard of it before. But Moderna is really a global leader in mRNA and has been one of the companies working on it for the longest anywhere in the world, and has been developing mRNA technology for over a decade. But people had never heard of mRNA until this pandemic, so wouldn't have paid attention to what Moderna was doing prior to this. So that's the first thing, is just that natural tendency to recognize and feel more comfort with a term you've heard before. And we really encourage people to treat them as equivalent, because we do know that Moderna has so much expertise in this technology. And then the second has been some of the unpredictability around the Moderna shipments. And so people have been nervous to book dose 1, not knowing whether or not they can get dose 2 of Moderna. And I think it also makes them feel a bit nervous when the supply chain is less predictable, can make them just more nervous in general about the product. But again, the supply chain can be unpredictable for many, many reasons. And at no point have we had any concern about the product itself. And now with so much supply, and the fact that we're recommending people can use the opposite product for dose 2 if it helps them to not delay their second dose, I hope that the supply inconsistency becomes less of an issue going forward. But the message from the clinical team is that these are both incredibly effective vaccines with very low side effects, and we recommend both of them equally.
Great, thanks for that. And just one for Johanna there, not jacket related. Moderna shipments, none next week, 52,000 the week after that, and then none confirmed from her. Is that a concern, or is this kind of just, wait and see, or do you have some sort of, in word from the federal government that more Moderna will be coming?
Yeah, it's not a major concern at this point. The signs from the federal government is that we're going to have the amount that we were always said we would get from Moderna. It's going to arrive. It's just precisely, which week it's going to arrive. By all accounts, we will have lots of Moderna coming into the system by mid-July. And it's just in the same way that we will have lots of Pfizer coming into the system by end of July. So no, I think we've sort of we've set up our planning system enough now, and so that we can just quickly and nimbly anticipate, this is the actual amount coming within the next couple of days. These are the channels that it needs to go to, and then we get it out the door. So I think we're mostly okay. It'll come, and we'll be ready for it when it does arrive. The walk-in option, it's attractive to Manitobans. It's also attractive to the planning team, because then we can just open up more walk-ins as opposed to have to go through something we've remarkably been able to avoid almost entirely, which is canceling appointments. So we're careful at this time not to lock ourselves into appointments for supply that is not necessarily coming on this particular day. So we're just monitoring that. But that aside, I think we're ready for the amount to arrive, and for more to arrive, frankly, than that 50,000. I think quite a bit more. We're just waiting for the confirmed shipment, and when it arrives, we'll pump it out, and we're excited for Manitoba to use it.
Great, thanks.
From CBC Radio Canada, Simon.
Hi. So first question is related to the success of today's walk-in appointment for youth. I'm wondering if you're intending to add more youth super clinic where they can go to.
Thanks, Simon. Yeah, we're looking at that. So every bit of Pfizer that is coming in by mid-July has been spoken for. It's either in an appointment or it's been allocated to a specific focused immunization team that's servicing a specific group or congregate living facility or context. But after mid-July, there's a lot more Pfizer coming in. We're actively looking at keeping a portion of walk-ins open. For this kind of youth walk-in clinic as well as appointments. Of course, we're also waiting on the possibility. We don't have any new indications from the clinical side, at least from Health Canada, but Dr. Reimer can flesh in on that. But if Moderna opens up for youth, then all our walk-in options become walk-in options for youth. So there's sort of two irons in the fire on in that regard. Is Pfizer coming in by end of July and having a walk-in component for youth, or the moment that Moderna is approved for youth and we get the thumbs up from the clinical team here, then all of those walk-in options become available to youth as well.
Are going to be at this super clinic or?
Oh, no, they'll be throughout the province.
Okay, and. The second question I have is related to the people who are vaccinated out of the province and they arrive here in Manitoba for work or any other reason. I'm wondering if there's enough vaccine for them, so they should not shy to get their vaccine here in Manitoba to get their second doses.
Absolutely. There's enough vaccine for them. They're encouraged to use any of the models out there to get their dose. If it's within the right interval, absolutely there's enough supply.
And what's the progress for this category of a person?
That's a good question. I don't have anything specifically on hand on what the uptake specifically is for individuals who had a dose outside of the province and are now getting their second dose inside the province. So if we judge by just generally how high the uptake is for the second dose, my guess would be pretty high, but I just don't have a figure on hand at the moment.
Thank you. Thank you for those answers.
From CBC Manitoba, Bart.
Hi, Dr. Reimer. You mentioned that 1.2% of COVID hospitalizations since the start of the year are breakthrough hospitalizations, breakthrough cases. But what's the actual number? We have approximately 500,000 Manitobans with 2 doses now. What's the total number of people who have 2 doses plus 14 days who've been hospitalized with COVID-19 in Manitoba?
I don't have the chart in front of me, but we can get that number to you. Our epidemiologists do track on a regular basis the number of hospitalizations, ICU admissions, and deaths amongst people who have received 1 or 2 doses. So while I don't know that number right now, we can get that for you.
All right, then. We'll inquire via email. Mr. Botha, I'm just going to ask you on camera to repeat what you said yesterday, actually. What I asked you yesterday about the Manitoba's turnaround. Like right now, actually, with the 34,000 doses recorded yesterday, we've now administered more than 1 dose for every Manitoban, including kids under 12. We were lagging behind other provinces for the early part of this year, and now we're tracking to be number 1 for 2 days in a row. It may not always stay there, but what factors do you attribute the turnaround of the vaccine program?
So, and I know that we use slightly different denominators on this, Bart. When we've measured ourselves on the eligible population, so 12 plus, the amount of 12 plus Manitobans out there compared to the eligible individuals in other provinces, per capita administration has been very, very high within the top 3-4 for a good long while now. I think what happened yesterday is because we have a fairly robust and fast system and Manitobans are rolling up their sleeves that even based on total population, we reached that per capita administration dose. So I don't know if anything major changed apart from the things I mentioned yesterday, the super sites ramping up, more supply and so on. But I think we were always moving fast. I think we just now hit that indicator as well. As you mentioned, though, no guarantee that we stay up there. We need to put in all the effort for this big push for July, and certainly Manitobans have to keep rolling up their sleeves.
Okay, there. And question for Dr. Reimer. Third doses, boosters, either for the Delta variant, when that becomes more prevalent, for people with 2 AZ doses, because those people, like myself, are slightly less immunized or less protected against Delta, and also for people with immunocompromised bodies who don't develop antibodies to 2 doses the way as other people. When do you foresee the third dose, the booster, becoming part of the regular program here in Manitoba?
Yeah, so far we've seen really good persistence of antibodies for people for many months after receiving the vaccine. We met last week with our American counterparts as well, and they reviewed a lot of their data and haven't seen any significant decrease in effectiveness in the time since vaccination so far with their data either. There is some newer data showing that perhaps past the 6-month mark that there might be a decrease in antibody levels, but what we don't yet know is whether or not that would translate to an actual decrease in protection. Because in some cases with other vaccines, we've seen even when the antibody numbers go down, that if the virus is present, the body very quickly can reproduce those numbers. So, I mean, the short answer is we really don't know yet, but that all of our data so far appears quite reassuring that protection lasts for as long as we've been able to measure it. So we're hopeful, but not planning that we won't have to do a third dose. Instead, we're planning for it so that we're ready if that does become necessary. And I think separately, we're looking at people who have immunocompromised for whatever reason, because we do have experience from other vaccines that show that sometimes a third dose can be necessary for those individuals. And we actually discussed that as well with our American counterparts last week, and even with immunocompromised individuals, they weren't yet seeing any change in effectiveness, but they were seeing changes in antibody levels. So they were recommending not starting a third dose yet, but to watch things very carefully to determine if truly that decrease or lower level of antibodies might translate into less protection. So I think our plan is to be ready, in the fall if a third dose was needed. But so far, no country has demonstrated that that will clearly be needed, and we'll have to wait and see what happens to protection levels as we go forward.
Our final reporter this afternoon from the Canadian Press, Steve.
Oh, hi there. I'd also like to ask a question about the high rate of vaccination that we're seeing and the ongoing uptick that we're seeing. Do you think part of that is based on the diverse but slower pipes that have been used to get vaccines out to people, such as the mobile clinics and the fit teams and the culturally appropriate settings in the community where people have been able to get doses?
I think those delivery models have certainly helped us in ticking up the dose 1 coverage to keep moving our way towards a higher percentage of individuals who have at least 1 dose, and not having that be stagnant, but actually still seeing it move up. In terms of the per capita doses administered metric, that one really is about speed. These are thousands of doses that has to be administered in relation to other provinces for us to sort of be at that ranking. So I think what I would attribute that to more than anything else is that we've had these big pipes, these large super sites ready for a long time. And over the last 2 to 3 weeks or so, we finally had enough supply to really move through them at this rate, at the same time as being able to open up second dose eligibility and Manitobans having clearly no issue with wanting to get their second dose. So sort of all three things aligned: high capacity versus through the super sites, robust supply, and then a large amount of demand from the second dose individuals who's willing to go through those super sites by the thousands. I think that more than anything explains the high per capita doses administered metric, whether it's by the whole population, which slightly disadvantages Manitoba because overall we have a slightly younger population, or whether we do the 12+ one. I think it's mostly about the super sites and second doses than about those models, as important as those models are.
Okay. And when it comes to the data we have on First Nations, the data's a few days old, but it seems to show quite strongly that in terms of the on-reserve population, both 1 and 2 doses, they're ahead of the provincial average, but the off-reserve population is well below the provincial average for both 1 dose and 2. I'm wondering, have you seen any encouraging signs that there's more uptick of late?
In terms of maybe I'll uptake. Always pivot to Dr. Reimer to get the clinical input, but I guess from the delivery side, what I'll say is that our urban Indigenous clinics are doing incredible work, and as far as I understand it, are looking to expand the kind of work that they are doing, and certainly at the joint tables that we sit at with the community partners that operationalize and run the urban Indigenous clinics, we want to as much as feasible increase the doses that we can move through those channels. So that's promising, and of course there has been tremendous success on First Nation. Questions on that, I'll defer to our First Nation partners at that table. But as always, Dr. Reimer, in terms of different uptake, different areas, I'll go to the health side.
Yeah, I mean, I think the most important thing is really to ask that question of our Indigenous health leaders who know the population and are working every single day on this rollout. So, we're so thankful of the work that they're doing. It's been just remarkable to see what amazing service they're providing to Indigenous people in Manitoba. And so, as far as numbers and uptake and perceptions of the community, I really think that getting that expertise from them would be much more ideal than getting it from me.
And another area where we have seen lower than average vaccination rates is in southern Manitoba. And it may be too early to come to any conclusion yet, but I know, Dr. Reimer, you were involved in one of the town halls specifically geared towards areas of southern Manitoba where people have a lot of questions about the vaccine. Have you seen any change in the uptake since those town halls?
Yeah, I think, like I've said before, we're seeing a slow and steady increase in the number of people going for that first dose, whether it's because their questions have been answered by their healthcare provider, by a town hall, or just by seeing the experience that their friends and family have had getting the vaccine. We do know that people will continue to slowly increase their confidence and comfort with the vaccine. And we intend to continue trying to reach out and answer those questions for people. So, Doctors Manitoba led those town halls that I was grateful to be able to participate in, the one for for Winkler and Morden area. And we want to keep doing that kind of work. So providing opportunities for community members to get direct access to people who can answer their questions and help them feel more comfortable, because we do think that the more we can connect with people, the more comfortable they'll feel about the vaccine, and continue with that slow and steady increase. I don't anticipate that we'll ever be able to come to a press conference and talk about a big jump in vaccine uptake in communities that have ongoing questions. But what I do want to be able to do is every week talk about how it's a little bit higher than last time.
Thanks, everyone. This concludes our media briefing.